Hi, Megan.
Hello.
I'm Dr. B. Nice to meet you.
Nice to meet you.
We will be doing an assessment on the back and the neck today, correct?
Mm-hmm.
Okay, and just for generalized aches and pains, or did you have like an accident or injury that we have to worry about?
No accident or injury, just some general aches on the left side.
Okay, I want to start by asking you just a couple of lifestyle questions. So what is your general day-to-day setup? Are you sitting most of the day? Or are you moving most of the day?
I work with kids in an after-school program, so I'm pretty active.
Pretty active.
Yeah,
Okay. Are you like picking these kids up at all?
No.
No. Okay.
Yeah.
So like not like a lot of like heavy lifting, just like running after them. And
Yeah.
So that's good because I see so many like tech workers that are just like hunched over. So that's kind of a nice change of pace. What about other forms of exercise? Are you doing daily, weekly, monthly exercise in any way?
I go on like walks and I do yoga occasionally, not as much as I should.
Okay, that's perfect. So, but you're getting your activity through work. So,
Yes.
You're not being sedentary. You wouldn't consider yourself sedentary.
No.
Any injuries, surgeries, physical limitations in the last like 5 years, let's say?
I had a carpal tunnel release surgery on the right side, but other than that.
Okay, so we'll check on that. We'll see how that's feeling. But better now after the surgery?
Much better.
Much better. Yeah. Okay, excellent. So what I usually do is just do an overall check of everything, and then we'll have you lay down and I'll sort of do more of an intense look at the back and the back of the neck. But first, any headaches?
Occasionally, yeah.
Okay, where in the head are you getting these headaches?
Normally like here, sometimes
Front
in the
and
back too, yeah.
So front and the back. Okay. Does it cause any dizziness, any sensitivity to light?
Sometimes light sensitivity. Yeah.
Okay, are you feeling any sort of migraine or headache at this time?
No, not today.
Because I want to look into your eyes. I'm going to have you just stare right over at that ear right here, okay? And we'll check the pupillary reactions. Okay, good. Can you see the tip of my pen light here? Can you just follow it with your eyes only? How often are you getting these headaches?
Maybe like once or twice a month.
Okay, so fairly consistently. We're just going to do one last move here. Okay, can you follow it in and out? Very good, so that's all fine. Any tingling, numbness in the hands, especially with the carpal tunnel issue?
There was, but not since the surgery.
Since then. Okay. Can you feel this here? Feel that there? Feel that down the leg? It's the same. All right, we'll start with your reflexes. Just make sure everything's working as intended. So I'm going to have you go loose for me, nice and relaxed. Perfect. I just need to, my hands are cold, I apologize. I just washed them though, so there we go. There we go, perfect. And stare again straight at that ear. Okay, I'm gonna try the other side now. Okay. We'll just compare side to side. Good, similar reactivity. There we go. And again, stare straight ahead. Okay, I'll get your knees now. Very good. Very reactive. That's excellent. Okay, that's all fine. So now I want to come around back. I'm going to feel the back just a little bit. And I'm going to ask you to make some motions for me. Let me know if there's any pain or tenderness as I palpate down here. I'm just going to move your hair to the side. Is that all right? Got really nice curly hair. Fellow curly hair appreciation. So you said you had some tenderness and some straining in the neck.
Yeah,
right here.
A little bit.
A little tender. Okay, yeah, it definitely feels way tighter than this side. I'll feel better when you're laying down, but... Okay, can you shrug your shoulders for me? Keep them up. Good. And push your head back into my hand. Any pain with that? Push your head forward. Okay. And laying down the back. Definitely some tightness here in the mid-back too. I don't know if that feels tender, but it feels tight to me personally.
A little bit, yeah.
Okay. So you do have a little bit of a slight forward movement with the shoulders. Again, very common. We're on our phones. I mean, I know that you don't work at a computer, but I'm sure you're still using a computer. Any pain in the bicep right here? That shoulder?
No.
Good. Okay. Feeling the shoulder blades. All right, can you lift your arms all the way up? Flip like this to me, and all the way up to the ceiling and down. Any pain with that?
Nope.
Okay, turn your head all the way this way that it can go. Any pain with that? All the way the other way that it can go.
There's a little bit of tightness.
A little bit of tightness right there with that. Okay, relax. Go back to the center. Go down as far as you can go. Any pulling there on this muscle?
A little bit, yeah.
A little. Okay, and come backwards all the way you can go. How does that feel?
That's okay.
Okay, I'm going to lift your head up. Tell me if there's any pain with this.
No.
No, so okay. I'm going to push your head down. Tell me if that's uncomfortable at all.
A little bit.
A little bit uncomfortable. Okay. Very common reaction. We often compress when we compress the nerves here, because we're all kind of hunched over, that just makes it even worse. So I'm going to have you twist side to side like this. Any issues with that?
Tight
Right here, so right where I felt, okay. And sort of tip this way for me. Anything there?
A little bit.
Okay, and the other way? Not as bad, or?
No. It feels kind of like relief. Maybe.
Yeah, okay, gotcha. So like that stretching feels good. Okay, let me tap you here. Okay, so I think I want to have you lay down. We've kind of ruled out any major, here, I'll come around, any major nerve issues, or, like I'm not worried you have like a slipped disc or anything like that. But I do want to take a closer look at your back. I'll just put the little head thing in here and we'll have you lay down, okay? All right, Megan, let's take a look at the back now that you are down here. We can just pull this up for now. We'll check the low back out in a minute. Any pain on your front now?
No.
Okay. So again, I'm going to warm up my hands a little bit for you here. So the left side is higher than the right, and that was where you had that pain too, right? More on that side, so that's makes sense. Bruising, which is good. Little tapping. Feeling for any spasms, any tightening of the muscles as I activate them. Palpate. Yeah, so way more swelling and edema on this side. Like almost nothing there, and then decent there. Are you left-handed or are you right-handed?
Right-handed.
Right-handed, okay. I'm wondering if there's something you're doing on this left side to create a little bit more tension or swelling. Because it pretty much goes the entire way up that this one is raised. But maybe you just need an adjustment, honestly. Yeah. And the swelling dissipates over here. This is pretty even side to side. Yeah, so I can feel that right there. That's pretty tense. So these are the paraspinal muscles. They run up along the spine. And then we have the scapula. We'll check the height of that. I think pretty even we'll measure, but it's not looking too bad. But there is a lot of tension right underneath this left side, and it's not really there on the right. Feel that compared to that? Yep. Okay, so the neck was bothering you a little bit as well. It's still this left side, isn't it?
Yeah.
Yeah, I can feel that. I wonder if it's your hip alignment. We'll check that in a bit. Usually with the hip alignment, we have the scapulas different. That's exactly the same. Okay, I'm going to feel the spine itself. I'm going to feel each vertebrae. So the spine's nice and easy to feel. There's not too much swelling here. Until we get right about here. But it's still not that bad. I'm not feeling any curvature. I'll do a couple of tests for that, but you've never been told you had scoliosis or anything, right?
No.
Yeah, no, it feels very straight. So you actually need it to be with, more than 10 degrees of difference to be considered like a true scoliosis case. It's like very easy to feel. We all have a little bit of natural curve to our spines. So this is a concise scoliosis meter, and yours is like pin straight. So we're not seeing any variation side to side. I mean, a degree or two is fine, but you're just dead on. Yeah, slightly there, but again, still within like 1 or 2 degrees. It's just not. It's not a big difference. So we're definitely going to need an adjustment here in the mid-back. But before we do that, let's do the Neuroscope. Are you allergic to anything?
No.
Okay, this is a lavender. It's a lavender lotion. So it should smell pretty nice, but I just don't want to scrape the skin at all. Yeah, it's a little cold. Sorry about that. It'll be a little shocking. There is one there. There too. Just a little wiggle. It's honestly, the whole back is not really. Just here, definitely a little. And it's very consistent until there. Sorry about that, ticklish. It's all good. It's all good. I'm also very ticklish at that part of my back, so I understand. Let's see, you're looking really good. Placing down. Ooh, okay, that setting, didn't like it right here. Going down. Yep. And then back to normal. And then just the neck. We'll have to do some neck work. Last setting here, touching down. Same thing. Okay. Okay. I'll work up into the scalp just a little bit. Try not to mess up your nice curls. Okay. I'm going to take your neck out here and just put you to the side. And we're just going to stretch. No cracking, just scratching, okay? Okay, and back in. Just that one side. There we go. Feeling how malleable the muscles are before I make this adjustment. Is pressure okay?
Mm-hmm.
Okay. Let me know if there's any pain beyond, tolerating. There's going to be some discomfort whenever we're breaking up this fascia, whenever we're taking these muscle fibers and trying to loosen them up. And I want to attempt our first adjustment. So take a nice deep breath in and out. Okay, just a couple. How was that first one? Is that okay?
Yeah.
Okay. Gonna have some motion going on. want to do one more adjustment on the mid-back. So take a nice deep breath in and out. Good. And now we're going to try the shoulder, because we're still a little high here. So I'm going to pop this one back into place. So deep breath in and out. Good. Excellent. Good, that moved nicely. Okay. I want to look at the mid-back just a smidge. So I'm going to come here around here. Do you mind if I pull this down just a little?
Sure.
Okay. And that thing. So yeah, this is super tight there. Are you doing a lot of like bending over with your job? Do you like bend over and pick things up like toys or things like that?
Yeah, and I get down on like the kids level too.
Oh, that's right. Okay. So yeah, that could definitely be a reason for some tightness. Are you, when you're going down, are you like squatting down, or are you like going kind of at the...
Kind of bending down
Kind of
too,
bending,
yeah.
okay. Because yeah, this is like super tight. I don't think I want to do any adjustments on the low back today. It feels really tender and tight, and I think it would do more harm than good. I just want to do a little bit more massage. I'm going to give you some exercises to strengthen your core, and then also I want you to practice bending at the knees and keeping the back straight, as opposed to sort of like bending over into a C shape, because that's definitely going to cause some low back pain. No, that's fine. So Megan, I think mostly environmental. I don't think there's any like injuries per se in the body. Let's check out. I think this is definitely a little lower now than it used to be, which is good. It'll help give you some immediate relief, but it's, you know, it's kind of a long-term problem when it's just about like posture and physical day-to-day physical activity that you're doing. Okay. So I'll cover you up for now. I'll have you put on your jacket, meet me out front to schedule you for the next few sessions. But I think, you know, mostly muscle tightness, especially here in the neck and the low back. Try and increase that yoga if you can. That will help a lot, especially any like seated twists or things like that where you're getting that rotation of your spine. But in the end, you know, we're always going to have a little bit of back pain when we're doing a lot of sort of physical manipulation of our body. So we might just have to come in and get adjusted every once in a while. Any questions for me?
No, I don't think so. Thank you.
Okay. Well, I'll see you out front, and we'll put some time in the book for us, okay?
That sounds good. Thank you.
Thank you.